Welcome back to Caring Beyond the Pew, where we explore the vital role of church leaders in providing compassionate care during life's most difficult moments. I'm your host, Sonia Koenig, and I am so glad you're joining us again. You know, many pastors feel unequipped to handle end of life care, but additional training can bridge that gap. And today we'll discuss why continuing education in the area of end of life care is critical. Continuing education in end of life care it is critical for ensuring compassionate, informed, and holistic support for individuals and families facing death. It equips caregivers, clergy, and healthcare professionals with the skills to navigate difficult conversations, address theological and ethical concerns, and it provides emotional, physical, spiritual, and psychosocial support. Proper training, it enhances communication, helps families make informed decisions about advanced care planning, hospice, and funeral arrangements while reducing fear and distress. Ongoing education, it also ensures that caregivers, pastors, church leaders, lay leaders, chaplains, healthcare professionals stay updated on best practices in palliative care, pain management, and patient centered decision making. It promotes dignity and quality of life. By strengthening the role of faith communities and healthcare providers, continuing education fosters a culture of preparedness and compassionate care. It ensures that individuals receive the guidance and support that they need during one of life's most profound moments. By investing in continuing education, caregivers, faith leaders, and healthcare professionals can provide more meaningful, knowledgeable, and compassionate support to individuals and families that are navigating the end of life process. So let's talk about the reasons church leaders do not have continuing education in end of life care. Number one, lack of awareness. Many church leaders do not realize the importance of specialized training in end of life care or how it can enhance their pastoral role. Number two, the discomfort with the topic. Death and dying can be difficult to discuss, and some leaders may avoid deeper education due to personal discomfort or fear of addressing these issues with their congregation. Number three, time constraints. Church leaders often juggle multiple responsibilities. It makes it difficult to prioritize ongoing education in a field they may see as secondary to other personal duties. Number four, limited training opportunities. Many seminaries and leadership programs, they don't offer or they don't emphasize end of life care, leaving leaders without accessible or structured educational resources on the topic. Number five, over resilience on prayer alone. Some church leaders, they believe that prayer and scripture are sufficient in addressing end of life concerns without recognizing the need for practical and emotional support training. Number six, financial constraints. Churches with limited budgets, they may not allocate funds for specialized training in areas like end of life care, prioritizing other ministry needs instead of end of life care. Number seven, assumption that it's a medical or family matter. Some leaders may assume that end of life care that it's primarily the responsibility of medical professionals or family members rather than seeing their role in providing guidance and support. Number eight, the fear of saying the wrong thing. Without proper training, leaders may feel unequipped to handle sensitive conversations about death and suffering. It leads them to avoid the topic altogether. Number nine, cultural or denominational barriers. Certain religious traditions, they may not emphasize structured pastoral care for the dying, leading to a lack of emphasis on continuing education in this area. And number 10, reactive versus proactive approach. Many church leaders address end of life concerns only when a crisis arises, rather than seeking proactive education to better support their congregation before the need becomes urgent. So now let's look at why church leaders having continuing education and why church leaders should have education in continuing end of life care. One, to provide compassionate and informed support. Church leaders are often the first point of contact for individuals and families facing death. Continuing education, it ensures that they can offer informed, compassionate, and practical guidance during this critical time. Number two, to address theological and spiritual concerns. Many people struggle with faith-related questions about death, suffering, and afterlife. Ongoing education equips leaders with theological and pastoral knowledge to comfort and give clarity. Number three, to improve communication skills. Conversations about death require sensitivity, training. It helps the church to navigate the discussions with empathy, reducing fear, and promoting peace of mind for the dying and their loved ones. Number four, to support families and practical decision making. Families often need guidance on medical choices, advance directives, and funeral planning. Church leaders with proper training can offer valuable support in these areas. Number five, to reduce common mistakes in pastoral care. Well-meaning leaders may unintentionally offer unhelpful advice, avoid difficult conversations, or rely solely on prayer when more support is needed. Ongoing education, it's helped them avoid these pitfalls. Number six, to strengthen the church's role in community care. By being well equipped in end-of-life care, church leaders can expand their ministry, offering grief support, facilitating discussions on death, and advocating for holistic care within the congregation. And seven, to ensure personal and ministerial growth. Continuing education allows church leaders to deepen their understanding, enhance their skills, and serve their congregations more effectively in one of life's most profound moments. So today, we've explored whether church leaders should receive more education on end-of-life care. And education, it's not a sign of weakness. It's a commitment to serve better. So if you feel inspired to take the next step in this ministry, begin by reflecting on your knowledge of end-of-life care. Do you feel equipped to support those in your congregation and community who are facing end of life? Do you know where to find the education you need to strengthen your skills in this area? In our next episode, we'll speak with Pastor Emma Jane. She is the Education Director from the End of Life Care Institute. She will share some valuable insights on how you can access the education and training that you would need to provide compassionate and informed decisions in end-of-life care. You don't want to miss this episode. Thank you for tuning in to Care Beyond the Pew. If you found this episode helpful, share with your team or your community, and let's continue building ministries that reflect Christ's love. Until next time, take care and remember, your ministry matters, especially in life's most challenging seasons.